Arteries are shown in red in this picture. Blood flows from the aorta, which is the largest artery in the body, to all parts of the body. The aorta lies in front of the spine and in the thoracic and abdominal cavities. Because the heart must have a constant supply of blood, it supplies itself with oxygenated blood through the coronary arteries. Coronary arteries are the first blood vessel branches off the aorta. When the heart relaxes, the coronary arteries fill with blood and supply the heart muscle with oxygen it needs. Branches of the aorta from the carotid and subclavian arteries. The left and right carotid arteries are the major arteries of the neck, supplying the head and neck with blood. A carotid pulse can be felt on each side of the neck. The subclavian arteries run under the clavicles and supply the upper extremities with blood and oxygen. The subclavian arteries branch into the axillary and brachial arteries in the upper arm. A brachial pulse can be felt on the inside of the arm between the elbow and the shoulder. The artery is used when determining blood pressures using a blood pressure cuff and stethoscope. The brachial arteries branch into the radial and ulnar arteries and supply the forearm with blood. The radial artery is the major artery of the lower arm. A radial pulse can be felt on the side of the wrist below the thumb. The femoral arteries are the major arteries of thighs, supplying the lower extremities with blood. A femoral pulse can be felt in the groin area, the crease between the abdomen and the thigh. Behind the knees, the femoral arteries become the popliteal arteries, and the popliteal arteries supply the lower extremities. Slightly below the knee, you can actually popliteal arteries become the tibial arteries, and the posterior tibial pulse is located just behind the ankle bone. At the ankle, one of the tibial arteries becomes the dorsalis pedis artery, which applies blood to the foot, and the dorsalis pedal pulse, often called a pedal pulse, can be felt on the top of the foot. Major veins. It's important to remember, well, first off, the veins are marked in blue here. Two largest veins in the human body are the inferior vena cava and the superior vena cava. These two veins empty oxygen, pour blood into the heart's right atrium. Superior vena cava returns blood from the head and upper extremities to the heart, and the inferior vena cava returns blood from the trunk and lower extremities to the heart. Remember, every artery has a vein, except for the carotid arteries, or not carotid, except for the coronary arteries in the heart. But every other artery has a vein. With the left ventricle contracts, a wave of blood is sent through the arteries, causing the arteries to expand and recoil. A pulse is the regular expansion and recoil of an artery caused by the movement of blood from the heart as it contracts. A pulse can be felt anywhere an artery passes near the skin surface and over a bone. Central pulses are located close to the heart, such as the carotid and femoral pulses, and peripheral pulses are located farther away from the heart, such as the radial, brachial, posterior tibial, and the pedal pulses. Blood pressure is force exerted by the blood in the inner walls of the heart and arteries. The systolic blood pressure is the pressure in an artery when the heart is pumping blood. The diastolic pressure is the pressure of an artery when the heart's at rest. The way I remember it is systolic squeeze, because when it's working, it's squeezing. Diastolic die, when it's at rest. A blood pressure measurement is made up of both a systolic and diastolic pressure. It is measured in millimeters of mercury, and blood pressure is written as a fraction. For example, the normal is 120/80. Blood pressure is dependent on the contraction of the heart, blood volume, and condition of the blood vessels. A slow or fast heart rate, a loss of blood, or a change in the elasticity of the blood vessels may lead to changes in blood pressure.